And as we look forward to 2019, how are different parts of this room and our communities really taking action, turning those ideas into policies? And so we have some lovely panel members here today to share with us what their organizations are doing in the area of health to pursue policies and different efforts throughout this year. So without further ado, Chris.
Great, thank you. Again, my name is Chris Bouneff. I'm Executive Director of the National Alliance on Mental Illness of Oregon. We're the state chapter of NAMI. I'm here to talk about advocacy. What we really do are free education and support programs for all people affected by mental illness, whether you live with a mental illness, whether you're a family member with a loved one, whether you're a parent or guardian raising a school-age child. We provide that education curriculum, structured support groups, all peer-based. We serve about 8,000 Oregonians across the state through our 15 chapters. I always like to mention that because, like a small nonprofit, we don't have a marketing budget. A lot of people will come to us and say, if I only knew you existed way back when. The only way people know about us is through word of mouth. We're here to help, again, straight with that lived experience. We're not a treatment provider, but we do provide probably sometimes something more valuable than treatment, which is a place to belong and knowledge. So enough about NAMI. What we're here to talk about is mental health, and there's not a place that I go anymore in the state. I was just, one of my fellow panelists asked me, well, how long have you been doing this? It's been 10 years. 10 years ago, just to get anywhere to somebody to pay attention to you, you'd have to storm the castle with your pitchforks and torches to get someone to even listen to you. Today, I just saw our bill list, and there's 6 pages of legislation in the 2019 legislature, some in some way touching on mental health. There's not a system around the state, from law enforcement to health care to schools, that doesn't understand the magnitude of the problem and how it's impacting them as a system. And so there's universal interest as to what to do, a lot of grasping at straws as to what to do, what should that be. That's where an organization like mine tries to bring people together from all various aspects of the system and figure out those strategies. We're going to go, and there's a handout back on the community table in the back that outlines what I'm going to describe to you. But we have 4 major priorities in this session. About 2 years ago, we received a major grant from a new foundation called the Wellbeing Trust to convene conversations about revolutionizing our healthcare system as it pertains to behavioral health, both mental health and substance use disorders. Unlike, say, the state of Oregon that tried to do this through this thing called the Behavioral Health Collaborative, we could do it in private. We could have provocative conversations. We could invite who we wanted to be at the table, people from all across the systems representing coordinated care organizations, hospital systems, representing private commercial health insurance, representing people like me with just lived experience, to discuss what do we do? How do we, if we were to start over, how would we do this? And we had those conversations. And then we started tying those conversations to this Coordinated Care Organization 2.0. What are these new contracts going to look like for the managed care plans that manage our Oregon Health Plan? And we began drilling down onto what we thought were essentials. And our fear is that whether this was planned or not, the health authority is releasing what those contracts look like at the time the legislature comes in session, which pretty much mutes any ability for advocacy organizations to affect what goes in those contracts. And we felt held hostage by that timeline, and we were determined to have a bill in place that we could amend and make to our liking to apply pressure on the health authority so that there were some non-negotiables, at least in the contracts for the next 5 years for coordinated care organizations. We call that the NAMI Brain Trust. I don't have a bill number yet because we're not quite sure which vehicle we're going to do this through. But there are some things that are really essential for us. This is an insurance term, but subdelegating risk. Right now in our state, I can be the CCO and I can take my pot of money for behavioral health and I can give it to somebody else and say, you manage that benefit, all of it, I'm done. I'm not going to have anything to do with this. And that causes problems across the state because you don't have one place to go to help coordinate your care. You end up going through various systems to cobble together both your medical health, some of those social determinants, some of what you need in behavioral health. And so one of our non-negotiables is that we ended that subdelegation of risk. We didn't want to prevent risk sharing, but we didn't want to just have a CCO offshore that out. I'm happy to say in the contracts, the new contracts, which of course I brought a copy of, in case I need to reference it, they stayed in there, end subdelegation of risk. Of course, they're not elaborate as to what that means. They just state it in a sentence, and you're still left as someone looking in the system for improvement. Well, how are you, Oregon Health Authority, going to actually do this? Some other things that we are hoping to require is actual coordination of care. Coordinated care organizations have the name coordinated in their name, and yet they don't provide that coordination of care. They don't provide that care management. So if I go into the hospital with acute psychosis and I come out, that plan really is not going to coordinate my care and the rest of my journey. So I may get stabilized in a hospital, but after that I really am on my own. Not only am I on my own, my family that may be supporting my support network, we're all on our own, kind of grasping as to what do we do next. So we wanted to mandate at the plan level some coordination of care. We get denied for services all the time, as they do in the medical world, and the denial comes, hey, you're denied. And that's great. Except if I'm stepping out of the hospital and I have just had an acute episode and you tell me I denied for the next level of service and you don't tell me what I should do, oftentimes we cycle right back into crisis. We're determined that in the mental health world, if a coordinated care organization, and eventually we're going to force commercial insurers to do this too, if they deny you service, they need to tell you what you need and where to go. It can't be enough when we're dealing with people who are at their most vulnerable point to say you just can't get that service. Even though your doctors, your psychiatrists, your psychologists, everybody's recommended this service, we're going to tell you no, and then you're stuck. We want to end that. So they need to provide either an alternate treatment at the time of denial, or if they don't do the denial fast enough, you default to the prescribed treatment. And really we want and continue to push. There's a high degree of variability as to how we treat people. So I could be in one part of the state and I'm going to get this type of care with these type of symptoms. And in another part of the state, I could have the same symptoms and I am eligible for completely different access to care. In mental health particularly, we lack these standards of care, and we will continue to use that legislation to push that world to develop standards of care. It's an ambitious piece of legislation. As I said, I don't have a bill number. Through some giant snafu, the legislative concept that we put forward came back to us, and this is just how difficult change is. It basically eliminated counties, and that's not hyperbole, right? We got a piece of legislation back that eliminated counties. Counties run mental health in this state. And we asked, well, this isn't ready. Our goal here isn't to eliminate counties. And the legislation got introduced, and we're getting called to the carpet by the counties saying, our financial support is contingent. We get financial support from the counties. Our financial support is contingent upon how you explain this legislation where you're sponsoring legislation to eliminate the counties. I only raise that as a point is change in our state is difficult because interests are entrenched. Not through ill will, but they are entrenched. And the type of change that we're trying to bring about is rather scary for all of us. And this legislation is scary for all of us because what we're asking to do is completely remake a system. It sort of explains why in Oregon this has been a difficult task. Any change has been incremental at best. And so that you have this system built around and various people with various pieces of the pie, and it is hard to give up your piece of the pie. But again, it's an ambitious piece of legislation, but we're going to push that. I'll breeze through the other ones because that's our biggest priority is really continuing to push revolution versus incremental change, which I think is a suitable role. Right. Is a suitable role for an advocacy organization because we're there to push. We're there to make people uncomfortable. I dare say at NAMI, we're really good at it. We annoy the hell out of people. And yet people still partner us. And so that, as I said, the other pieces are related, but I'll breeze through them. One of the issues in our state, and I just saw my colleague Bob Bouneff with Disability Rights Oregon, and he's going to disagree vehemently with what I'm about to say in some respects. Civil commitment in our state. So, if you are so ill, your symptoms are so bad that we all recognize that you cannot make good decisions for yourself and you are at risk of harm. We always say danger to others. I'm talking about danger to self. I'm at risk of dying. I'm at risk of living in the streets. I'm at risk of losing everything in my life because my symptoms are so bad I can't quite see I need help. We have a legal process. It's compulsory treatment. It is not what should be our first line of defense. It is an extreme response when people are in crisis. In this state, it has become increasingly hard to commit someone. We will allow people to go out and die. We're fine with that as a state, apparently. It's not because the law has changed. It's because over time, terminology in the law has been interpreted by our courts as to narrow the definition of who meets criteria for mandatory treatment. We are supporting legislation that makes some modest tweaks to the civil commitment statutes and adds definitions, statutory definitions, to a term like near future. What does that mean? If I'm in danger of harming myself in the near future, right now that means almost immediately. We'd like to see that horizon a little broader. And also, what does danger to self and others actually mean? What is that danger? Is it that I'm imminently about to harm somebody else and harm myself, like right in that moment? Or is there a broader horizon? We would like to see the broader horizon. We make these proposals with great humility. I've been doing this for 10 years. I remember a time in the state where we committed people more easily, and then we stuck them in the state hospital, and we put them in bunk beds in the hallway. And we said, that's good enough for you. Right? We traumatize people. That was in 2006 when the federal government came into this state and said, you are violating people's civil rights. This is not a step that we take very lightly because compulsory treatment, this could be just as easily abused as it could be help. But I think at this point it is a necessary change to our statutes. And so we do this very cautiously, but I think it's necessary. Like I said, Bob can give the counterpoint to that. 2 years ago, we formed what's called the Mental Health Clinical Advisory Group. We were at odds with the Oregon Health Authority over something. We said, look, we lack standards of care. Why don't we form a group? We have the HERC. We have all this crap around there telling us what care ought to look like on the medical side, and we don't have anybody telling us what should look like on the mental health side. And in fact, we were asking the medical side to determine what good mental health care. Well, it's like, let's form a body with actual experts in mental health, people who do the business, people who experience the care, and let's put together treatment algorithms. What are the best practices that all Oregonians should have access to if I show up, for example, with psychotic symptoms? What does that look like? What are we supposed to do? So we formed this work group. It's sunsetted. The health authority and us, usually sometimes at things we're at odds, we're actually going together on this, and we're going to renew that group and have that group continue its work so that we hope to influence the provision of care across the state so that no matter where I am, I get the best treatment, access to the best treatment, best medicines, best psychotherapies, best support services, the whole, enchilada, as they say. And so that's a really high priority for us because that group's work has been tremendous. And then lastly, I'll just touch on this as our fourth priority. The governor's budget, and this may have been talked about, includes a lot of money for housing. And yet it's only one type of housing, and it's not necessarily suitable for our population. We actually, with Representative Keny-Guyer, so there's some coincidence sitting next to her legislative person, created a trust fund in which the legislature can deposit money, and it incentivizes the development of all kinds of housing for our population. So housing with supports, independent housing, treatment housing, something we call crisis respite, where I may live for 7 to 14 days, right? For us, that's housing, because that's where I live for a given period of time. This type of housing that we need all across the state to help us reach both a level of stability and a level of long-term recovery and success and engagement in our community. So we'll be asking for lottery bond funding to go into this specialized fund. What I like about this fund is it pays only 35% of the development costs for a project. Right? It's an incentive. So the state doesn't have to pay 100% of the cost. And often, particularly in rural areas, what we're finding is the rest of that financing for this type of housing comes through conventional bank loans. Right? So they're going into the private sector, and so that state investment is leveraging private dollars that bring about a project. We have, to date, through that fund, we have built more than $125 million in market value of various kinds of housing across the state. So it has proven its worth. And these four things together, we feel like really are, they all overlap. And with all four of them together, we feel like that will push us forward this legislative session as, again, we continue that revolution. Thank you.
Point this. Oh, is that yours? All right. Yep. All right. I think this is it. Okay, hi. I'm Jana Gastellum. I'm the Climate Program Director at Oregon Environmental Council, and I so appreciate being here today. Oregon Environmental Council is a 50-year-old organization. We're a statewide environmental nonprofit. We work on clean and plentiful water, slowing global warming, transportation, environmental health, and reducing toxics in the environment, and then looking at how we connect rural and urban parts of the state together. And we were formed back in 1968 when individuals came together and said, you know, there really isn't a voice for the environment and environmental health concerns. And I'm really inspired by our history and thinking about how people can make change. And it's really about collective energy and collective action. And I really appreciate the work that Allies for Healthy Oregon does to bring communities together and how interdisciplinary this panel is. So thank you so much for inviting us to be here today. I wanted to touch on two big environmental concerns that really overlap with health. And then reflect back on Dr. Jones's conversation this morning. But I'm going to touch on diesel pollution and climate change. And these are both legacy issues, and they're issues where we have a lot of cleanup to do in the state. They disparately impact communities, and if we don't address them, they snowball and they grow and they exacerbate existing programs. So climate change in particular is a threat multiplier. It makes bad air quality days worse. It exposes already vulnerable populations to extreme heat and weather. It creates water quality problems. I don't think anyone would have ever anticipated that in 2018, our state's capital would have unhealthy drinking water. When those toxic algae blooms come because of warmer weather, more runoff into waterways, suddenly you have people who used to be able to turn on their public drinking water. Now you have to pay for it, and now you have this new threat. And we don't have systems in place to deal with all of these impacts that we hadn't imagined before. It introduces more disease. It exacerbates mental health concerns, food insecurity, and displacement. Already there are climate refugees in Oregon, and that will be a growing number as well. So when I think about Dr. Jones's presentation this morning and that cliff, climate change is making that slope to that cliff a lot steeper. And when wildfires sweep through entire communities, it pushes an entire community to that edge and then over that edge. When you look at communities that have experienced these types of natural, unnatural in some ways, events, and you look at them 2 years later, the mental health issues in communities are often unmet. There's not the resources to deal with an entire population. And so we have to address the root cause of these problems. And with climate change, that's our energy systems. And so we absolutely need systems change along the way. So 2019, our legislative session, I think there's a lot of hope on the table for really making significant progress on a lot of these problems. So I'm going to start with diesel. My colleague Jen Coleman with Oregon Environmental Council is in the room. She's our real expert on environmental health. I'm going to do the best I can with what she prepared for me, but Jen is an incredible resource, and there's additional materials back on the community table as well. So the big problem with diesel pollution is that it contributes to air quality, and it's one of our worst air toxics problems in the state. And it contributes to overall cancer risks in many areas, but health impacts are particularly concentrated amongst people who live near busy roadways or near equipment that operates at high frequency. So new diesel engines are a lot cleaner, which is the good news, but old engines last a really, really long time, and there's no requirements to clean them up, and there aren't resources to do so, and we have no standards or requirements for that cleanup. Some of the timelines that we've had in the past have not really been well enforced. They haven't been well resourced, and so we've missed a lot of deadlines for cleanup as well. We do have this opportunity to jumpstart this cleanup with what's known as the Volkswagen settlement dollars. We have $72.9 million that have come to Oregon after Volkswagen had their scandal, and their cars were emitting more toxic diesel emissions than they said they were. But $72.9 million is not enough to clean up the entire problem, and so it needs to be paired with standards for cleaning up the rest of the problem. So in 2019, Senator Dembro and Rep. Power will introduce bills that will, one, set a timeline for retiring old on-road engines. It will also stop the purchase of old on-road engines, because right now we have neighboring states with higher standards, and Oregon is at risk of becoming a dumping ground for old, dirty engines. It will give local authorities power to set up strict idling standards as well, because when engines just sit there and idle, you create a lot of local air pollution problems. It will newly create an inspection program for on-road diesel engines as well. So some of us in Portland and Medford, we have to get our gasoline-powered cars checked every 2 years to make sure that they're meeting air quality standards. We don't have the same system in place for diesel engines. Nor do we know all of the old engines that are in our state. And so the legislation would newly require registration of off-road engines as well. And then it would set additional standards for the use of these Volkswagen settlement dollars to ensure that there's equity. So where are communities being impacted worst by diesel air pollution, and how do we target dollars to cleaning up those engines first? It is a community effort to move this forward. Neighbors for Clean Air, OPAL, Oregon Environmental Council, Physicians for Social Responsibility are really at the lead of helping push this advocacy in Salem. But it's going to take a broader community effort as well. So we welcome everyone's participation and engagement. And again, you can find more information at the back of the room. I am going to switch gears to addressing climate change. The second piece of legislation I'm going to talk about is called the Clean Energy Jobs Bill. And similar to Chris, we're waiting for bill numbers for both the diesel legislation and the Clean Energy Jobs Bill. But this bill has three essential parts. It's a cap, a price, and invest. And it addresses the fact that Oregon has never had enforceable limits across all of our major sources of climate pollution in the state. We've had aspirational goals, but we know voluntary measures are not sufficient to addressing this critical problem. So this would set an actual cap or enforceable limits on climate pollution in the state and look at near-term interim targets by 2035 as well as longer-term targets by 2050 in the time frame that science says is necessary for dramatically reducing our climate pollution. Secondly, it addresses the problem that climate change, climate impacts are considered an externality. Businesses, energy, decision makers, they don't wake up in the morning and think about climate change. They don't have to. There's no financial cost to it. There's no rewards for addressing it. So this program would set up a requirement that major sources of climate pollution in the state now have to hold permits for their pollution. The number of permits will decline every year. That's how the cap gets enforced. And those permits will now have a fee associated with them, so it's no longer free to emit. And it creates accountability in the system and internal incentives to reduce pollution and be rewarded for it. And this is critical, I think, for accountability because, again, when we think about climate impacts, last year we spent $500 million as a state fighting wildfire costs that are growing because of climate change. But you and I are paying for it as taxpayers. State and local budgets are being robbed because of climate impacts. And the folks who aren't paying are Chevron and Exxon and large emitters in the state, and we need to remedy that. Finally, reinvest the proceeds from the sale of those permits back into solutions, back into addressing the root cause of the problem, and investing back into communities. Because ultimately, we need climate solutions at the individual, local, and societal scales. And we need to look at how we can be benefiting Oregon communities who are hit first and worst by climate impacts and other disparities. So this can be things like investing more in energy efficiency, in housing, and in buildings. When you do that, you make homes more comfortable. You also cut energy costs and energy burden. We can invest in things like community-scale renewables, which builds resiliency in the face of a whole variety of different types of impacts. And for coastal communities or others where you're a lot more isolated, having more energy security and more direct access to renewables can create these additional benefits. It would support clean transportation, which also continues to help with air quality, and then also leads to more affordable transportation as well. If you drive on electricity, it's the equivalent of filling your car on $1 per gallon fuel rather than $3, $3.50, or an kind of unstable petroleum price. So it can help cut household expenses that way as well. And then it also harnesses forest and other natural lands to help sequester carbon in our landscape and restore landscapes. That has benefits for wildlife, for water systems, and drinking water supplies as well. And then it also will fund job training and other worker services, including mental health services. Climate change, again, will displace people. We have climate-sensitive industries in the state, like our oyster hatcheries. When our oceans acidify, what will happen to people when you can't do that anymore? So how are we making sure that we're creating systems that support people through transitions as well? The bill, the Clean Energy Jobs Bill, is supported by Senate President Courtney, House Speaker Tina Kotek, Governor Brown, and is being championed by Senator Dembro and Representative Power as well. And it will be introduced in the Joint Committee on Carbon Reduction. Advocacy is being led by the Renew Oregon campaign, which is led by a steering committee of the Oregon League of Conservation Voters, affiliated tribes of Northwest Indians, Pacoon, Oregon Environmental Council, Climate Solutions, and Sustainable Northwest. And this decision-making body thinks it's very important that there be dedicated resources specifically to most impacted communities, to Oregon tribes, and that there be inclusive decision-making in how this program is implemented, and then ultimately in the use of those proceeds as well. And then more broadly, it's supported by a coalition of supporters of nearly 1,000 businesses, 140 faith leaders, 195 small farms, sustainable farms, and then individuals in every legislative district throughout the state. So the urgency of these issues couldn't be more apparent. Last October, the world's leading experts said we really have a decade to significantly address climate change before we may hit irreversible impacts. And when we think about all the work that we've done up to this point on poverty reduction and making gains in the healthcare system, we don't want to see climate change unravel the good work that's been done and create new crises. So I hope you'll join me in supporting the Clean Energy Jobs Bill, and I look forward to supporting your initiatives as well. Thank you.
I'm actually going to stand so I can see my own slides. My name is Lynn Knox, and I'm the State Healthcare Liaison for the Oregon Food Bank. When I was asked to be on this policy panel, I said, well, you know, I'm not the legislative representative for the Oregon Food Bank. And Suzanne said, but you deal with policy on so many levels that why don't you see if you could figure out how to talk about that? So I do want to address a little bit what we do legislatively, because the Oregon Food Bank is not just a safety net organization. We try very hard to focus much of our work on preventive activity, addressing social determinants of health, and allying with other organizations and issues that are the root causes of hunger. That's our goal, is to address root causes rather than just keep applying Band-Aids. So this session of the legislature, one of our top priorities will be similar to the last several sessions, and that is supporting our allies in the housing arena. Because our customers at the 2,000 food pantries we work with across the state tell us that housing costs, or the inability to find housing, is the number one reason they're showing up and asking for help with food. So it only stands to reason that we need to get involved in that problem. In addition, we're going to be asking the legislature for $1 million to create a fund that doubles people's SNAP dollars when they go and purchase from local agriculture at a farmer's market, a farm stand, or a little market maybe in a rural area where there isn't a farmer's market, but that is offering some local produce. So it's a win-win for local agriculture and low-income people who have SNAP cards. This particular initiative has not been filed yet, but it will be in the next few weeks. We have both Republican and Democrat senators sponsoring it. We've established a federal pilot program through the National Farm Bill. This is not the Oregon legislature. This is the federal Farm Bill that was finally passed in December, that there's a new program to support veggie prescriptions throughout the country. And there's been a little bit of work on this previously by the feds, and then a moderate amount in many different states. Here in Oregon, we have 15 different programs that provide vouchers at clinics that can be taken to farmers markets or grocers to get people good local produce. And that will be expanded, and we've worked to get those federal resources. Following that, the other kinds of ways that people can impact policy and that we're working on are certainly at the state level with the Oregon Health Authority. Social determinants of health, as you know, are a top priority in the new CCO 2.0. But we've got to make sure that there's something to that, that people know what that means, that they have the information about what's going on in their local communities and what options are, so that they can take action to support social determinants of health at the CCO level or at the clinic level. So often as I travel from clinics to clinic and hospital to hospital around the state, they just don't have a clue about what their own local resources are. And that's got to change, and hopefully with this new mandate as part of 2.0, the CCOs will take that responsibility to help beginning to make those connections. And Oregon Food Bank's certainly a part of that, and we've taken leadership in trying to identify those resources on each county level. But often, when you get beyond the food arena, it's hard to connect people with resources that are existing in housing, in transportation, in employment opportunities. And so that's where some policy action on the CCO, the county, the multiple community level needs to take place, and hopefully people will begin to see with this new health emphasis on the need for work on those social determinants that are really putting the rubber to the road on equity. We can talk about wanting to achieve equity, but until we begin to move forward as a community on the ways that that has really hurt people, that racism and ableism has hurt the community, and start to come up with concrete community-based solutions, we're not going to achieve that goal of equity. So with OHA, we've supported all of this work on the new 2.0 move to social determinants, but are continuing to press for accountability within that. Talk is not enough, and we've worked with them to create a incentive metric that's moving forward, which will probably be implemented in 2020, that looks at screening for social determinants and helping connect people to the resources that do exist so that it's taken into account with everyone's care. With OHA, we've tried to help them move forward and get the CCOs to move forward on using health-related services, which is the old Kitsauber air conditioner story about somebody's heart congestive situation is exacerbated by the fact they live in a large building that has no air conditioning. And in the summer, they keep ending up in the emergency room because they have such heat that they're supposed to survive in. And if we would have paid $250 to get them a room air conditioner, they wouldn't be landing in the emergency room and costing thousands. That aspect of the accountable health system here in Oregon has not been fully realized. It's on the CCO level that we need to urge action to create that system, because each one is different. Each of the 15 CCOs have different processes for how providers can say, she really needs to get to the gym, and she has no transportation. Can't we pay for that? To say, gee, this child really needs to participate in an after-school support group, but he has no transportation to get home because his parents are working. Can't we support that? We need a veggie prescription program. Can't we support that? Yes, we can, but it's up to the CCOs in each community, and so all of us to work with our CCOs to see that they have those policies that can really create that patient-centered health care on the local level. Let me see, that's the same one. With clinics and hospitals, there's a lot that their own policies can do to support patient health, the equity of services, and the promotion of work on social determinants. And so if all you want to do is work with your local hospital to see that they are connecting patients to local resources, or to see that they are using their community benefit funds to do things that improve supports and services in your local community, that is incredibly valuable. The message is there are so many ways you can address policy. It doesn't have to be legislative, both federal or state. It can be very much based in your own community with your own CCO, getting on their advisory councils, just engaging with them, or engaging with your own little clinic. talking to people as you go for health care about what are we doing about connecting people who are food insecure with new resources, and can I help? There just are many levels of policy where action is very, very valuable. Thank you.
Hello. Hi. Good afternoon, everyone. My name is Kathy Way, and I'm the Legislative Director for Representative Alissa Keny-Guyer, who unfortunately cannot be here today because she is in Salem. She is in Salem along with our other legislators doing a full day of mandatory trainings, which will help them prepare and get ready for this upcoming session. So she sends her deepest apologies, and so rather than have her come here, she sent me, who I'll be. So I'll talk about some of her top priorities and issues this session. I think before I dig into that, House District 46 is one of the most diverse districts here in Oregon. It encompasses large parts of Southeast 82nd Avenue. IRCO, the Immigrant and Refugee Community Organization, also borders that, as well as APANO, Asian Pacific American Network of Oregon. And we also have historical neighborhoods near Mount Tabor as well, and Laurelhurst. So it's a big swath of area with lots of different growing needs. And as I mentioned before, it's also one of the most diverse areas in Oregon. So whenever we are thinking about policy or the types of things that Representative Keny-Guyer works on, we're also using an equity lens to take a look at who will be most impacted or affected by the changes that we are trying to bring forward. Representative Alissa Keny-Guyer, I think, how many of you know her personally by just a raise of hands? Okay, so some of you have met her or have worked with our office to pass legislation before. Some of the highlights that we were able to pass in previous years included data collection on racial and ethnic communities. It was really important for communities of color that we were working with to have data, Oregon Health Authority's data, that really looked at communities of color in a way that was disaggregated data. It wasn't right to just focus on Asians as just one big group, for example, but to really look at what are the ethnic communities that represent the Asian category, as well as separating African American to African immigrant, Pacific Islanders, and all of the other subgroups within the Pacific Islands. So that was one piece of really significant legislation that we worked with many folks here in this room on, is really to take a look at the data more clearly so that we can come up with more culturally specific interventions. The second piece that Representative Keny-Guyer worked on was really around cultural competency for healthcare workers. So a lot of our hospital nurses, doctors, psychiatrists, there's a whole list of healthcare professionals that interact with many communities and many families. And we found that in speaking to a lot of our community organizations, that there was a lot of persistent health disparities. And so we worked on a bill, I believe in 2015, that really strengthened continuing education for those professionals so that they know how to talk to and work with communities and individuals where English may not be a first language. So that's just a little bit of a preview to some of the health equity issues that the representative has worked on in the past. And currently, she is serving her fourth term, so she's very excited to be in Salem again, to serve another year, to really work with communities on issues that are affecting us. So one of the main positions, important and powerful positions that she holds, is Chair of Housing and Human Services. So as chair, a lot of the many committees that are focused on providing services for some of our most vulnerable Oregonians are going to be in her committee. So this is sort of, if you're taking notes, please contact our office, please reach out to us. please see me in the back if you are working on any of these bills or ideas that are related to Housing and Human Services, because we will be tracking those bills carefully. So with housing is going to be one of our top priority issues. We know that, Oregon, we still need to make a lot of progress when it comes to increasing our supply of housing options for various folks. I will touch on that later on with some of the supportive housing policies that we have. And we also need to protect renters here in our state from, really high rent increases that are pricing people out and pricing communities out. So just as a recap around housing, last biennium, House Bill 4007, it increased the document recording fee to $75. And for the first time in our state's history, this created an affordable housing and first-time home ownership savings account. We know that Oregon as a state, we're really behind when it comes to home ownership rates. Those rates are even worse for people of color to own and buy their own home in Oregon. So it was really important for Representative Keny-Guyer to focus on creating an account so that we have more first-time home buyers. We also increased EHA or SHAP, which is basically the Emergency Housing Assistance and the State Homeless Assistance Program 5 times fold. So it went from $10 million per biennium in the last session, and now it increased to close to $50 million. So that's additional funds that community service agencies can use to provide emergency housing assistance to clients and families. And in House Bill 24, some of you may remember, 2004, will probably remember this. It's a rent stabilization or tenant protections bill. It passed in the House last biennium, but it failed in the Senate by 1 vote. So we are coming at this issue again. You may already be hearing some news that is coming out of the Speaker's bill around tenant protections. Representative Alissa Keny-Guyer is supporting everything that we can do to prevent to prevent high increases in rent prices. This is a particular bill that will establish caps on rent increases, and it will also give renters the protection against no-cause evictions. So we're still trying to work out a lot of the details with this bill. It's about 75 pages was the last time that I took a look at it. And we're working with a lot of community advocates on, what is going to be the right way for tenant protections and rent stabilization to pass this year. We are also in support of the governor's funding proposal on housing. As I mentioned before, she has committed to major investments in housing supply, as well as really increasing the Emergency Housing Assistance Program and the State Homeless Assistance Program. Some of the different housing alternatives, as Chris mentioned earlier, for NAMI that deals with supportive housing, is also a major area of priority and concern for Representative Keny-Guyer. It's not just one thing to just put someone in a house and make sure that they're going to do fine. We really need to couple the mental and the counseling and the supportive services with those opportunities, so that folks who are going through domestic violence or severely addicted, they also have the right services in place when they are in housing. So I'm really glad that NAMI is working on that, and we hope to further that relationship and partnership with other advocates who are also working on housing and behavioral health. And then last but not least, one of our major priorities is the mortgage interest deduction reform. So every biennium, about $1 billion, this is housing subsidy dollars, get basically one of the top wealthiest folks in our state get $1 billion back in this mortgage interest deduction, and it really puts a fair disadvantage towards working folks, people of color, and others who may not be making over $500,000 in our state annually. So we need to reform this tax structure. Representative Alissa Keny-Guyer has introduced this in the last last session, and she really wants to bring forward this. And again, it will free up some significant resources to invest in making housing more affordable for Oregon families. What we want to do with the $1 billion that our state generates, and again, this goes back to very wealthy homeowners and even folks with second homes, is that we're trying to create some type of funding mechanism so that it will redirect some funds to affordable home ownership and to state homelessness programs for children. And hopefully with that added funding, we can also help pay for some of the housing costs that are rising. Last but not least, we're also working on housing supply, so that's adding more capacity to rural areas by working with Association of Oregon Counties. They are really working on, how do we address this issue of housing shortage in our counties? And so we're working on a bill. It's called House Bill 2228. And Speaker Kotek is also introducing a bill to increase more density in single-family neighborhoods. So those are all of the things that are related to housing. I'm sorry it's very long, but as you can tell, we have a really robust agenda around, the top issue that's facing our state. In addition to housing, some of the human services areas that I'll just lightly touch on is over the interim, we convened a child abuse prevention work group, and out of that work group, there were several recommendations. The first is to fund the Oregon Child Abuse Prevalence Study. Secondly, we want to increase staff capacity within the Oregon Department of Education to work with all of our school districts across Oregon to inform and implement Aaron's Law, which is basically training teachers, counselors, other frontline staff to prevent, detect, and report sexual abuse. The third piece that came out of the Child Abuse Prevention Work Group is increasing funding for child abuse intervention centers. So these are intervention centers that, take calls from mandatory reporters, as well as folks who may be experiencing abuse, and they really work with them, as well as other systems, to provide the care, provide intervention and needed services, as well as the follow-up. And last but not least, also want to touch on some of the mental and behavioral health policies. So last biennium, there was House Bill 3090 that directed hospital emergency rooms to create and publicize discharge and release policies for people with mental health crisis. House Bill 3091 required CCOs and private insurance to pay for the behavioral health assessment needs in the ER and recommended treatment. So again, I think, this idea that we want to take a holistic approach with behavioral and mental health and make sure that regardless of, whether you are, on OHP or have, private insurance, that if you have behavioral and mental health conditions, that you are getting seen and treated in the most effective way possible. And then some other things that are related along that is that we're also working with Multnomah County on a behavioral health crisis services legislative concept, and that will actually be working more with private insurers to make sure that private insurers are also covering the range of services and treatment options around behavioral health. And couple more. We also have some ideas around funding one position for an adult suicide prevention coordinator. Unfortunately, in our state, we don't have someone who is dedicated to looking at coordinating services for adult suicide prevention. We do have someone who does youth prevention, and this person would be looking at, providing training to counselors, to physicians, to other staff who work with various communities to make sure that we can also be detecting, adult suicide prevention cases. And last but not least, we are working on access to options for women when they are giving birth. So there, for almost a year, there has been a stakeholder group with birth centers, CCOs, insurers, and it's really to make sure that women have different options for where they would like to deliver their babies. This is a very important issue that also touches on equity as well, and so we are working with the Oregon Midwifery Council to make sure that birth centers are also fairly reimbursed at the same rates as other places do. We also have a growing workforce of midwives as well as other professionals who really. And this is, I'm sorry, let me back up. This is for low-risk pregnancies. So if a woman wants to deliver a baby, at a midwifery center or another birthing place, not in a hospital traditional setting, she can have the opportunity to do that, and she can also pay with OHP, and that will be a fairer rate than what it is currently. So those are some of the things that we are working on. It's a full agenda. Lots of offices are busy right now. We're going through about 1,000 bills this session. And so what is happening this week is that some of the first 1,000 bills have come through in the state legislature, and committees are getting assigned to each of those bills. And so I was able to get away from the building for a couple hours to be here, and would love to answer any of your questions. Thanks.
Thank you to all of our panelists. So we do have a few moments for just 2 or 3 questions. So if you have a question and would like to come to one of these microphones at the side, or if you raise your hand if you need assistance, and one of our volunteers will come by and pick up your question. I was wondering, Jana, when you talk about addressing the older diesel engines that are in our communities, are those primarily commercially operated or individuals? Do we know who this would impact?
That's a great question. I'm going to look to Jen to correct me if I'm wrong. Primarily commercially operated engines, and we're looking at fleet engines that operate primarily in neighborhoods. So ones that kind of, whether it's delivery or freight, garbage haulers. And in the Volkswagen Settlement Fund, it identifies 10 different classes of vehicles that can be funded for conversion, which can also include transit. We can upgrade to electric buses. School buses are eligible as well. But it's not really looking at individual pickup trucks that run on diesel. One of the
elephants in the room for Oregon in terms of the legislature is the lack of revenue. There's been several tries to reform that. I heard a couple of things from the panelists about, example, the mortgage deduction change, but can you talk a little bit more about what might be coming up in terms of revenue reform, especially Ms. Coy, about that? And the reason why I ask is Oregon public health funding from the legislature per capita has been ranked, this is 2011, 47th in the nation. This is during the Obama administration, and it's worse now. The legislators that I talk to always talk about, well, that's important, et cetera, et cetera. These are the social determinants of health, the types of things that health departments do with the CCOs and can't do. We need to support public health modernization. So public health modernization in terms of funding, and then revenue reform, which actually covers everything else that you talked about, the capability of doing that, having the money to do it.
Thank you. Well, that is a huge question around revenue reform. So I'm not going to go into all of the details of that because that would be something that I think I would like Representative Alissa Keny-Guyer to speak more directly on. So I'm not trying to dodge your question at all, but along the revenue conversation that she would be most interested right now is around education funding. So you mentioned public health. We definitely hear that we need to fund public health services, And I think we will do that through some of the increase in the cigarette tax that Senator Monis Anderson is working on. But in terms of revenue reform, I also serve on the North Clackamas School Board. So as a school board member, as well as folks who might be parents here or are just concerned about K through 12 education in our state, those conversations are happening as we speak. The top 4 priorities that leadership has expressed is revenue funding and revenue reform and specific funding for K through 12 public education. Second is housing. So how are we going to deal with, the increase in homelessness and rent spikes in our state? The third priority is around climate change. And the fourth one I'm forgetting is around housing, healthcare, climate, and revenue. So those are the 4 top issues that leadership has expressed interest in. Unfortunately, Rep. Keny-Guyer is not on any of the Ways and Means committees, so I'm sorry that I can't speak specifically to that. But we all acknowledge that we need to do something about the big hole that we have in our K through 12 education budget.
One more question in the back here. We'll take quick.
Yes, my question has to do with mental health and basically how the rights of mentally challenged people are violated, discounted. What, as far as housing goes, will be implemented to ensure that people with mental health issues don't suffer evictions due to their condition or no-cause evictions for trying to take care of themselves or complying with their mental health program? How is that going to pan out in Oregon?
That's a great question, because no matter what, we usually get screwed. And that's, we act weird, right? When our symptoms are at our worst, it's how we interact with the world. And usually the supports, when we talk about supported housing, we're not talking about the supports that help us succeed in housing. We're usually talking about, tenant supports, all these kind of supports that help someone stay in housing, but that don't actually meet our healthcare needs to help us stay in housing. And so it's going to be critical, and this is going to be a challenge, because even in the governor's budget, it's more. It has to be more than just rental supports, and it has to be just more than, hey, we're going to form a resident council, and isn't this going to be great? People are going to feel connected to their community. Well, for us, that's crap, right? I mean, what we need is someone to help us stay here and help us stay in recovery. And when we are most vulnerable, help us retain our housing by helping us interact with the world so that the world isn't judging us and trying to kick us out. And I see your shoulders giggling, because this is true. This happens to us all the time.
I'm speaking from experience.
Yeah, it's you do, and forgive me, I start getting agitated about this stuff.
It's quite all right, I understand.
But it's because people forget about what we need. They give us lip service and say, we're going to meet your needs, and yet they don't come to us and ask us specifically, what is it that you need? What they usually come and tell us is, hey, we're going to do these great tenant things. The policies around criminal convictions and guilty except for insanity, all that stuff is encouraging. And yet, it's not even the criminal side or the GEI side that bothers me the most. It's the part that we come with a diagnosis, and right then we're discriminated against. And they look at us. I mean, it's as if somebody's keeping a watchful eye that if one hair is out of place, we're going to figure out a way to get rid of you.
Thank you.
Well, thank you so much to our panel. Oh, sorry.
I was wondering in terms of the equity, in terms of taxing corporations and people, and I remember on the ballot, I think it was the ballot 97, or Measure 97, where it was going to tax like the high top dollar corporations as a way to kind of equalize and what we're talking about in terms of these services. And so I'm wondering how it can actually be brought back up and then framed in a way that it's not towards the corporations, like they're getting a bad deal and it's affecting the people. So I was wondering if there's a possibility to kind of bring back Measure 97, because that's kind of to equalize the field and have corporations pay their share. Equity.
Nice.
Rep. Kenny, thank you for that. Yes, we also need to do corporate reform, corporate tax reform, and Rep. Keny-Guyer was a huge supporter of Measure 97. So thank you for bringing that up, and she will be working on that.
And I don't have tax policy expertise, but I think I would just reflect from the conversation today that we really do need to change the narrative around taxation, that it's not an imposition, but it's about community. And I think that narrative of the individual versus the collective, that really, when we're taking care of each other, that's better for all of us. Like, how liberating is it to think about our communities being healthy and taken care of? And what an honor to contribute to that. So I think we have a collective responsibility to change the narrative about what it means to contribute and what it means to be part of a community, because there's a strong counter-narrative about what taxation means in this country that I think we have to change. Personal view there, but I think that the conversation, the framing earlier today really sets the stage. And again, thinking about this idea of zero-sum game and scarcity. Like, we have a lot of resources in our communities. It accrues to certain people in certain ways, but those are human-made structures, and we can change those human-made structures.
And I think that is a really excellent note for us to end on and for us to go on into, the rest of this year together, that we are a community together, and how can we together affect more change in the year to come and make some progress. So thank you for leading on these issues. Thank you, everybody in the room, for leading and contributing. Thank you for the excellent questions. Thanks to our panelists.